Hello, good morning. Today I'm going to take a presentation on the modified meaningful use stage 2. My name is Sam T. Kuruvilla and I work for ZH Healthcare, and I'm going to show you today regarding just to give you a brief up on what I'm going to show you today. It is going to be an introduction on modified meaningful use stage 2. Two, I'm going to explain how to meet all the criteria that we have given in meaningful use stage 2 in the modified version, how to meet all those in BlueEHS. Thirdly, I'm going to explain about the meaningful use stage 2 dashboard that we have in our BlueEHS system. And fourthly, I'm going to give you an introduction of clinical quality measures and how that is achieved in BlueEHS. Hope you're going to enjoy this session that I'm going to take. So firstly, I'm going to give you an introduction on meaningful use stage 2, the modified version. I had taken an earlier session on meaningful use stage 2, and in that I suggested that I told that there were 17 core measures which has to be mandatorily met by all the users, and there are 6 menu measures out of which every provider has to choose. When I said users, I mean the provider or the eligible professional had to choose 3 out of the 6 menu measures to do. So basically there were 20 measures that needed to be done in the original draft of the meaningful use stage 2. Now, on October 22nd, 2015, there has been a change brought into the meaningful use criteria for stage 2, whereby they do not have to meet those. They have cut down the measures from 23 to a total of 10 objectives. And from that 10 objectives, you have to meet all 10, but they have cut down on a majority of things that were expected in the past, and it is brought down to just 10. So from those 10, I'm going to give you an explanation on each of those 10 measures and how they are going to be met in our BlueEHS system. It is going to be a quick overview on how it is done. And I think it would help you going forward achieving meaningful use stage 2. One of the things I wanted to add is, as far as a person who is doing meaningful use stage 1 also, they also have to meet the same 10 measures as it is for a person meeting meaningful use stage 2, the only difference being the cutoffs. The cutoff percentage for the measures are going to be different for a person for a provider doing meaningful use stage 1 and a provider doing meaningful use stage 2. So this is a document that I'm going to use, whereby I'm going to tell you how you are going to achieve meaningful use stage 2 going forward. So I'm going to come down to the measures. One of the things I want to tell you that this measures are for providers in 2015 through 2017. So whoever is using doing meaningful use stage 2 in from 2015 to 2017 can adhere to this particular draft of MU2 that was given on October 22nd, 2015. So I'm going to go one by one on the objectives. The first objective that we have is public health, protect patient health information. When you say protect patient health information, there has to be a security review, that a security risk analysis that has to be done at the practice. Now, one of the two things as far as the security risk analysis is concerned is, one, a risk analysis that is done at the side of the vendor of the EMR or the EHS or the EHR, and one done at the practice where the provider is practicing. So there are two sides to the security risk analysis. Now, as far as BlueEHS is concerned, as far as the vendor side of the security risk analysis, that has been done at the certification stage itself. So the system is secure as far as the vendor side is concerned. But as far as the practice side is concerned, for the provider to meet this, they need to do a security risk analysis using a consultant at their practice. Now you can get the guidelines on how to conduct the security risk analysis on the Meaningful Use Stage 2 website. That you can easily get the information there. So this is just that you have to conduct that security risk analysis. There is no numerator or denominator associated with the protect patient health information criteria or the objective. You just have to meet it, whereby you conduct that security risk analysis. Now, going on to Objective 2. Objective 2 has two parts to it. One, to have clinical decision support intervention rules. There are 5 rules that has to be activated within a system so that this is maintained or qualified. Now, out of the 5 rules, clinical decision support rules, 4 of them have to be related to the CQMs that you are doing. Now, CQM is going to be the last topic that I'm going to cover this day. So out of the 5 clinical decision support rules, you have to maintain 4 as related to the clinical quality measures that you are doing. So just want to go into the BlueEHS system for a moment. So I'm just going to show you where this clinical decision support rule has been set. If you look at it, I'm going to show you how to set it in the BlueEHS system. To activate this clinical decision support rule, you have to go into the settings and go into module installer. And when you go into module installer, this has to be done by an administrator. You just enable the CDR. CDR is Clinical Decision Rule Engine. So this rule engine, Clinical Decision Rule Engine, is what is going to help you in the clinical decision support measure that you have to meet. So now if you go into, I'm just going to refresh the screen after having activated it. And after having refreshed the screen, if I go into the main menu once again into our database, I can see something called as a CDR engine. Now, CDR engine is the clinical decision rule engine. I'm going to go into the clinical decision rule engine. And if you see, there are a lot of clinical decision support rules that we have already set into the system. Now, one of the things that this is going to do basically is, now, suppose you are doing diabetes eye exam. You are a provider who does diabetes eye exam or a foot exam. Now, whenever there is a patient who's going to have a diagnosis associated with the eye exam or foot exam, our system is going to give you an alert when you log into the demographics page of that patient. Basically, for conditions like hypertension or influenza or pneumonia, based on the diagnoses that are entered into the patient in the past, there is going to be a help for the providers, basically a clinical decision support. That's what the measure mentions, a clinical decision support given to the providers by the system so that they can treat the patient better. So in case there is a patient walking with a condition of diabetes eye exam, when you log into the system for the system or into that patient, it is going to give you a pop-up of saying that this particular patient has this particular problem. Please take care of it. So they have asked as a mandate that you should have at least 5 clinical decision support. Now, if you look at the system, we have around 17 of them activated. In a standard system, we should at least have 9 activated, 9 of this CQMs activated within the system. So it should not be a problem. Now, the only criteria that you have to maintain is that your CDR engine, which I said in the module installer, you have to go and enable it. Once you enable it, this will automatically give you this pop-up. Now, just to go briefly into a patient to show how this clinical decision support rule is going to help you. If you go into a patient, John Doe, when you after having made the the decision support rule on enabling it, if you look at it now, John Doe has a problem as far as this condition is concerned. I'm not sure. So based on based on the condition that you have set in the CDR engine, a support is going to come saying, okay, this is when you log into John Doe, it is going to tell you that, okay, Mr. John Doe has a problem with this. Whatever is this, I'm not very sure. We'll have to check it. But this is how the pop-up is going to come, and it's going to support you in creating that rule, or support you in taking specific care of that patient for that particular condition that he is in. So this is that pop-up. This is what is going to help you. This is the clinical decision support engine that we have in the system. Now, that is the clinical decision support. Now, just going to go back into the spreadsheet, the sheet that I was talking from earlier. Okay. So now, as far as the Objective 2 is concerned, they said they have to implement at least 5 clinical decision support rule. In every database that we have in BlueEHS, at least 9 have been set. And now they mentioned one more thing, that 4 of the 5 need to be related to the clinical quality measures that you are doing as a provider. Now, what is clinical quality measures and how is it linked to this clinical decision support rule? I will explain at the very end, after having explained the CQM, which is going to come at the very end. So let me go into the measure 2 of clinical decision support. The measure 2 is the EP has enabled and implemented the functionality for drug-to-drug and drug allergy interaction checks. Now, there, as far as our system is concerned, anybody who is using the, let me just take the BlueEHS system. Okay, going into the BlueEHS system, any provider who has ERX is activated in their system, they will automatically have this feature. They do not have to worry about it. So when you go into the ERX of any patient, what it will do is you will be entering the current medications, the allergies of this patient inside this e-prescription area in a structured manner. So based on what the patient has been already prescribed and what the allergies the patient has, if there is any drug that you are going to additionally put into the system is automatically going to alert you if there is any drug to drug interaction, the drug that you are giving now and the drug that is there in the was given in the past. So if you are, or if there is any drug allergy interaction, you have entered the allergies here. If there is any interaction between the allergy that you have entered and the drug that you are going to trying to prescribe from this ERX module, you will automatically be alerted on the same. So this drug to drug and drug allergy interaction is automatically taken care of as long as you are using the ERX module. So you need to mandatorily use the ERX module going forward. It is found here in this area of the EMR, the ERX module. Now, going back into my document. So the 2 measures that we require as far as clinical decision support is 5 clinical decision support rule. 5 that is automatically activated if you go into module installer and activate the CDR engine, and then when you go into a patient, it will alert you on certain conditions that the patient has. Then 2, if you are using e-prescription or ERX, you will automatically be alerted about drug-to-drug and drug allergy interactions by the system. So that is taken care of. Objective 2 is taken care of. Now going into Objective 3. As far as the Objective 3 is concerned, the first one is 60% of the medication orders created by EP during the reporting period are recorded using CPOE or computerized provider order entry. Now, one of the things that I wanted to mention in these CPOE criteria, which is the third one, if a provider orders less than 100 medications or orders less than 100 laboratory orders or has less than 100 radiology orders, they can apply for an exemption for this. In the sense, there are three different measures for this. The first measure is 60% of the medications ordered has to be entered in a computerized provider order entry. So again, in the EMR, this is again using the ERX module, which I had shown earlier. You have to use the ERX module to be entering. Just going into the BlueEHS just to show you. Okay. So as far as the first measure is concerned, you have to use the ERX module and enter the medications in through the ERX module for 60% of the medications that you are entering for the patient. So if you are in med entry in the ERX, you can put in the drug name and search. Sorry, you can come here, search for a drug, and if you are prescribing this drug for the patient, you can just click on a particular drug and move this drug to the current medication. So I just moved the current medications right now, today on the 19th, and that took care of. This counts as one among those 60%. So 60% of the drugs that you prescribe during the reporting period, you should be doing it in a computerized provider order entry. It should be done through the ERX module in the system, in the BlueEHS system. Now, as far as the training for the ERX module is concerned, it is going to come in the following week. So if you have any queries as to how to use the ERX module, you can do so in the next meeting. That's about the ERX module. Now, going back into our screen, into our PDF. So 60% of the medications. Now the exclusion for this particular measure, part 1 of the CPOE, is if a EP prescribe fewer than 100 medications, he can just forget about it. He doesn't need to look at it. Now the second part is more than 30% of the laboratory orders created by the EP during the reporting period are recorded using CPOE. So if you have, this is again, if you have an exclusion, if you don't do 100 laboratory orders. If you're doing more than 100, you have to do it. More than 30% of the lab orders, you need to put it in the system in a computerized provider order entry format. So just going into the BlueEHS screen again. So in the BlueEHS screen, there is this lab module. So you go into the lab module. So to be able to prescribe a medication for a patient, you should mandatorily choose an encounter. So Mr. John Doe, I'm going to choose an encounter. Once I choose an encounter and I come into the lab module, it gives me an option where I can enter a lab. Now, there can be two types of laboratories that are entered. One is external. If you are integrated to an external lab, that like Quest or Dynon or SingleX lab, you'll have it listed here. Or if you are not having any external labs integrated into the system, you have to create your own internal labs. So I'm going to create two labs. One for just going to remove this particular lab, and I'm going to create two labs. One for internal laboratory or internal lab. I'm going to save it as save it. And I'm going to create one for radiology as well, because the next criteria is internal radiology, to measure radiology order, to enter radiology orders. I'm going to choose the protocol as radiology too. So I have two labs now in the system. One is internal lab and internal radiology. Now, if I go into my procedure order, I had added this in the providers. I have internal lab and internal radiology. Along with it, you can have other labs as well, which are, if you are integrated to say a lab that is externally integrated, that has to be done through us. BlueEHS has to take the initiative to integrate with an external lab. You can integrate and directly send orders from the system to that lab. But otherwise, you have to, for meeting meaningful use stage 2 criteria, you have to record your labs. So this is your internal lab, this is your internal radiology. I'm going to create now to be able to enter a lab. So suppose you are Dr. 1 and you want to send an order to a internal lab, and if you have the order date will come here. If you have any internal comments to be given, you can give here. This patient and any the priority of this high, what status let will be pending. Direct result is if you are going to directly enter the result for this order without collecting the specimen, then it is a direct result. Generally, the labs are not direct result. There is a specimen collection involved. Radiology will be a direct result. So that's why this option is given. So then after having entered this portion, you enter the diagnosis. Now the procedure order. Now if you look at it, there is no procedure order here, because as far as the internal lab is concerned, you have to create your own set of laboratory orders. Now how do you do that? So I'm going to go into this area, hover on this, go into procedure configuration. I'm going to click on procedure configuration and add a lab. So I'm going to click on add here, and I'm going to go into orders, and I'm going to, suppose I want to add urine. Urine is a lab, and is urine test. This is what I call it. You can create your own tests inside this, and you have to, for each patient, when you do a test, you record that test inside the system. So I'm going to put in urine test, and this is an internal lab, not a radiology, and I'm going to put the code for urine test as 1. So this is my first. You can put it anything as in how you like, as far as yours, and you just save it. So urine becomes if you go into the last page, I think you should be showing urine test is added here. Now, if I go back into the procedure configuration, this is for internal lab. I'm going to choose internal lab, and I'm going to come back. I'm going to put in a diagnosis here, and I'm going to type in urine. You see the urine test that I added has come here, and I can save it. So if I save it, this meets the criteria for meaningful use. I do not have to bother. So when I send an order, if the direct result has not been checked, it will go into specimen collection, where the test I just entered, urine test, specimen collect. I can give a note after collecting the specimen, and I can finish and say that it is final and save it. When I save it, it will go into the result entry screen. If you go into the result entry screen, this is going to be here. You can enter, okay, this is abnormal, no. What is the value? 32, and unit is urine rate. Depends on what the ratio and the range. If you want to give it the range, normally is 10 to 20. So you can save it, and this becomes a part of the record of this patient. If you go into batch results, you will see this result that we entered as a record for this patient. But you do not have to go and undertake all this for the meaningful use. The only thing you have to do is, for every encounter of every patient, at least for 30% of the patient, you need to go into the procedure order, and you have to enter the lab as a structured data here. If you do a urine test, if you do a blood test, you have to do the test from here. If you don't have a test, if you want to create a test, when you try to order a test, you can go into the procedure configuration and add the order as I mentioned. So you have to do out of, if you are doing 200 labs, you have to at least make sure that 60 of them is entered in a structured format in this lab module. Now, one of the things that I want to specify is lab can be ordered only on encounter days. So you need to make sure that the patient's encounter is selected while you're doing the lab. Now, the next thing that I want to go into is just going into the PDF again. So 30% of the laboratory orders, 60% of the medication. Again, I want to specify if you have less than 100 laboratory orders, you can just avoid it. Now, going into measure 3, 30% of radiology orders also you need to do. So 30% of the radiology orders, if you just present it so that you see, more than 30% of the radiology orders created by the EP during the EHR reporting period needs to be recorded in a computerized provider order entry. Now, just going to present the EHS again. Okay. Now, in the EHS, this time for entering radiology orders, you have to enter it into the radiology section. And most likely for radiology, it is going to be an image that is going to be a result. So you have to click direct result. In that case, when you save it, it is not going into the specimen collection like the lab. It will go into the result entry screen. Now you can put in a diagnosis, but as I suggested earlier, there is not going to be anything because under urine test or anything, because you have to add an order under the radiology, internal radiology lab. So I'm going to go back into the procedure configuration. I'm going to click add, and I'm going to add an order and say X-ray for chest. And I'm going to put it as internal radiology order form under order, and I'm going to put it as X-ray so that I'm going to just put the code, or let's just put the code as 1. Again, this is the first radiology order. You can have a numerical code or any sort of code. So I just save it, and X-ray becomes a part of my procedures. And if I go into the procedure order, I go into internal radiology, I put in some diagnosis code, and then I put in X-ray. I can save it. Now, since I did not check direct result, it will again go into the specimen collection area. Now, I'll just make an order entry without the specimen collection, so with the direct result, so that you understand what the concept is. X-ray. Sorry, choose one. I save it. This time, the second order won't be going to the specimen collection area. It is already collected. Just a moment. I don't think direct result. X-ray. Yes. In the second scenario, what happens when you put direct result, you do have the option to do a specimen collection. But one of the things that I want to mention is it also comes in the result entry area directly. If you look at, I made 3 orders which are in specimen collection. If you look at it, there are 4 orders, out of which This one I did the specimen, collected the specimen collection and sent it as final, but this one I did not check the direct results. That's why it is only lying here. The other two I checked the direct results. That's why it is in the result entry area directly. You can also optionally collect the specimen, but it is not a mandate in this case. So as far as radiology is concerned, if it's an X-ray, you can just, if you have the image on your system, you can just click on this and choose the image and open and upload it. This way, you can store the result here. But the important thing, as I mentioned earlier, is not that you do the result entry. Only thing you have to create orders. 30% of the orders has to be inside this, either internal lab or internal radiology. This has to be put in, and you can create this labs from this provider area if you are wanting to do so. That's the thing about labs, internal lab and internal radiology. Now I'm just going back into the screen, the PDF. So 30% of the radiology, 30% of the laboratory, and 60% of the medications has to be measured in the system this way, in the computerized provider order entry. Now going quickly into the next one, I just wanted to mention that you can avoid these if you have less than 100 orders. That's that. Now going quickly into the fourth one, electronic prescribing. More than 50% of the permissible prescriptions written by EP are queried for a drug formulary and transmitted electronically using CHERT. So this again, as far as our system is concerned, as long as you are using the ERX, e-prescribe module, you will take care of this one. It does the query for the drug formulary is done every time by the ERX module. So you do not have to worry. As long as you are using that, this is taken care of. And as I mentioned, e-prescribing is going to be taken at a later point of time. Now, health information exchange. The EP that transitions or refers their patient to another setting of care. Let me just summarize this to you. Any provider who transitions, just a moment, I think I just forgot to share. I'm just going to come back into the PDF and just go back. This has been taken care of. For this one, you have to just use the e-prescription module to take care of this one as this fourth measure, which is query for drug formulary. Only you have to use e-prescription to take care of that one in the BlueEHS. As far as the fifth one is concerned, health information exchange. This is a criteria where if you are transitioning your patient to another setting of care, you are transitioning to another setting of care, you are giving away the patient to another setting of care, you have to have this EHR has to have the capability to create a summary of care. Creation of a summary of care is a capability that the EHR needs, which is there with our system. And for 10% of those patients whom you are transitioning, you have to make sure that you electronically send them, transmit them the summary of care. So for 10% of the patients, now I'm going to go into the system to show you how you're going to send it. So I'm going to make bring the BlueEHS. Now, if I am going into an encounter of a patient, suppose John Doe, I'm going into this encounter. Now, if I click the share button, okay, I have an option called so to calculate, to tell that this is a transition of care patient, I'm just going out. You have to click on the share button to record the fact that this is a patient you are transitioning to another setting of care. You have to make a checkbox here. When you check this checkbox, it means that you are stating that this is a patient you are transitioning to another setting of care. Now, to 10% of the patient whom you are transitioning, we have to have uh, we have to send electronically the information of this patient to that provider to whom you are transitioning care. So you click on EMR Direct after clicking on this, and you can put in a direct address of the patient. Now, what is a direct address? Direct address is something called as the female ID, PHI male ID, female ID. Now, female ID, every doctor can register for a female ID by going into uh, the EMR Direct website. EMR Direct, you can Google EMR Direct, and from there you can register for a female ID. So that female ID you will receive. So suppose the female ID of the whom you are transitioning is it will be something like the email ID itself. So say john@emrdirect.com. You can just type in here John at now emrdirect.com. Now, if it is not there in your system, you can just add the physician's name, John, and his email ID is john at emrdirect.com. So you just add it, and this will make sure that this physician, the next time you search for such a email ID, it will come along. You just have to add it once, then you just add it, it becomes a direct address. You can send this patient seems to be in need for a surgery, and you click on send. It will electronically send to John at EMR Direct. This is a invalid email ID. So you click on send, it will become one among those patients for whom you electronically transfer the data based on whether it is a transition of care patient. So the criteria is, one, you have to check this checkbox to make sure that this is a transition of care patient. You have to choose the email ID or the direct address to send this email to that or send this detail, the clinical summary, to that provider to whom you are transitioning the care for this particular patient, John Doe, whom you are looking. You click on send, it will take care of the 10%. It will take care of the one among those 10%. So out of 100 that you check here, 10 at least you have to go into EMR Direct, put in the email ID, the direct address, and send it. And you have to create your own direct address. That is the first thing, so that it's like an email thing only. The other provider to whom you are sending will have a direct address, so will you. So from the direct address for your database, you can set in your system, and thereby you can send direct the summary of care to 10% of the patients, 10% of the patients to the providers to whom you are transitioning the care of a patient. Now, going on to the sixth measure. I think I finished this one. So you have to do electronically transmit for 10% of the transition of care patients. Now, going on to the sixth measure, patient-specific educational resources for 10% of the patients. So one of the things you can do is you can keep a printout of various sort of educational resources that you are planning to give for the various patients that are pertinent to the practice that you are working or the line that you are working in. And you can keep a printout on the desk and you give it to the patients. And once you have given it, to record the fact that you have given it, what you do is, I'm going to go back to the EHS. In your encounter screen, you have an area where you can view the encounter summary. Okay, not this one. Let me just, Yeah, here it is, encounter summary. In the encounter summary, you have to make sure that you check this checkbox, which is medication reconciliation performed. You do not have to save it. It is an auto save. So if not medication reconciliation, I'm so sorry. It's patient educational resources, provided educational resources. So basically the fact that you have provided educational resources, you have to record in the system. So for 10% of the encounters that you create in the system, you have to make sure that you provide educational resources. You provide it manually, but you check this checkbox here to make sure that they understand that you have provided it. And the system understands, or the system reads that you have provided it. That is in the encounter summary. You have to check the checkbox which I showed you to make sure that you record that one, that you have provided educational summary. Going to the next one. For 50% of the patients, you have to make sure that you perform medical reconciliation. Now, as far as medical reconciliation is concerned, this happens when a patient is referred to you. Unlike the fifth measure, when somebody else refers a patient to you, you have the opportunity to do this medical reconciliation. So if you have I'm going to go into the EHR. So how do you indicate the fact that this is a patient that has been transitioned to your practice? So in the encounter summary, there is a checkbox called transition transfer of care. So if you check this checkbox, it indicates that this is a patient that has come to your practice from another setting of care. This has been transitioned to you. Now, to record the fact that you have conducted the medical reconciliation, you have to check this checkbox. Now, as far as medical reconciliation is concerned, what is medical reconciliation is? You have to look at the drug history of the patient, what has been prescribed in the past, what medication history he has, and based on the allergies, the medications that you have, that the patient has already, which you can get obviously from the ERX or the e-prescription site that we have. Based on that, you prescribe the optimum medication. You have to make sure that you reconcile or view all that he has in the past and make an optimal judgment and give him the medical medicines. So you have to perform that medical reconciliation, and the way to mark it is, if it is a transition of care patient who has been transitioned to your practice, you check this checkbox. If the medical reconciliation is performed, you have to click on medication reconciliation performed. So at least 50% of the patient, you need to do this medication reconciliation. This checkbox needs to be checked for 50% of the patients for whom this checkbox has been checked. So this is the denominator, this is the numerator for this criteria. Now, going into the eighth measure. For 50% of the patients, at least for more than 50% of the patient, you need to give the patient portal access. Now, to give patient portal access, it's a very simple process. I'm just, I think I didn't share my screen. For 50% of the patient, you need to give patient portal access. That is this criteria number 8, 50% of the patients. Now, going into the system. How do you give patient portal access? So I'm going into Mr. John Doe. There are a few things that need to be done before the patient portal access is given. So you see this portal credential, this won't be active for every patient. Only if this is active, you can give credentials too. So to make this active, you have to go into this. First, you have to give in the patient's email ID here, the contact email ID of the profile. Secondly, in the choices section, you will have a section called choices. You have to make allow patient portal as yes. By default, it will be no. So you have to go into every patient and make it yes when you are seeing the patient and save it. When you save it, what automatically happens is the portal credential option will come here. So for 50% of the patients whom you see, you just click on portal credentials. This will give them a portal credential. You just save it and it will automatically go to their email ID as well as this username, and use this password that is created will enable them to log in from their end. So out of the 50%, there is one more criteria that is there, which I'm just going to mention about this time. Going into the EMR screen again. Not the EMR screen, the file which I am talking from. Out of the 50%, you need to get out of the 50%, one patient, you have to make sure that they log in and they log into the patient portal and view their information. So when you log into the patient portal, there is going to be a button called My Providers. Click on My Providers, and that will show you the various, that will show the patient the various practices that are connected to that the patient is connected to, and they have to choose the practice you are or the specific provider is from. Once that is chosen, the criteria will be taken. At least one patient has to do that. That's it. At least one patient seen by the EP report views, downloads, or transmits. They have to either view or download or transmit to a third party. I think view will take care of the view will take care of the thing. So they have to, one patient has to log into the patient portal, click on My Providers, go into, if they are connected to multiple providers, this patient, they have to go into your specific provider. So provider name or the facility ID, and there they have to just view their information, one patient. Now, one of the things that I can mention as advice to get this done is ask one of the patients who are at your front office to log in from your own computer in the practice, one or two of the patients, just to avoid risk, and just go and view the information. Or if you have a couple of people in the front office who are also patients in your office, you can make sure that they can log in and just meet this criteria. So only one patient has to view their information. 50% has to be given. So you give to make it in a workflow to give this, get the email ID, make patient, allow patient portal as yes, and save it and give the portal credentials to most of the patients who are coming into your practice. Ninthly, secure messaging. This criteria is our patient portal needs ability to send secure messages to the doctor if required. That ability is there. There's no criteria that so many patients need to send it. That ability is there, very well there within our system as far as the BlueEHS is concerned. So that also is taken care of. No need to worry about that. That is taken care of automatically. It's a yes. And the 10th measure is a public health measure. As far as a public health measure, there are three measures that are there. Either immunization registry is one option, syndromic surveillance is another option, and specialized registry reporting is another option. Specialized registry reporting is an option we do not have in BlueEHS, as that is not registered while we certified BlueEHS. So, and you need to do 2 out of the 3. As far as stage 2 is concerned, 2 measures out of the 3. So you have to, as far as BlueEHS is concerned, you have to do either immunization registry or syndromic surveillance. Now, as far as immunization registry and syndromic surveillance is concerned, if this immunization registry or the syndromic surveillance registry, those registries that collect these sort of immunization and syndromic surveillance data is not there in your jurisdiction or the place where you are from, you can ask for an exemption on this. There are various exclusion. If you do not administer immunization, or if you operate in a jurisdiction for which no immunization registry or information system is capable of accepting the data, those sort of things. Similarly for syndromic surveillance. So if you do not do either of this, you can ask for an exemption. But if you do it, you can very well submit the data by going into the system. I'm just going to the system just to show you. So if you go into the system, there is an area where you can enter the immunization. If you go into this main menu, you can go into care coordination. For the immunization registry, you can get the data from this immunization area. You can do a search. You can type in the immunization. And if this is the immunization for which you want to send the data, you can click this and do a search. If there are any patient, there's no patient data in the system, it will list this, and you will have the option to basically search and send it. Once you will have check boxes here, you can check and send it to whatever the registry, or you can export it to an Excel, whatever format they ask, you can just send it from the system. Same here with syndromic surveillance. You have the option of adding on the basis of certain diagnosis. You can pull a report from here and also send it to a registry from here by exporting to CSV if you want, and whatever format they ask, you have it. Basically, it is under care coordination, and under main menu care coordination, you have under export, you have immunization and syndromic surveillance, from where you can search and send the data. So that is that. So I'll just go into the document again just to show the document. So that brings to an end the 10 measures. Basically, out of this 10, you have to do all 10. One of the things I want to mention is, as far as the public health reporting is concerned, for stage 1, you need to do only 1 out of 3. Stage 2, you need to do 2 out of the 3. So that is the 10 measures. I hope it has brought some clarity on how to meet meaningful use stage 2. That was the explanation on the various 10 criteria. Now going to the dashboard, just want to show you a dashboard. It is being prepared so that you can monitor how you are doing on the various measures. So just want to present to you. So in the main menu, there is an MU2 Dashboard report, MU2 report. You can start you can start it from October 1st to present date. And if you are Dr. 2, you can do a search. And for each of this, you can see, how you do. This is the numerator, the denominator, the required percentage will be given. There has to be, this was made according to the old criteria. We are rectifying and modifying so that you see only the 10 instead of, this was the old 23 and 17 and 6 that were there in the old MU2 criteria. The modified MU2 is coming, but this dashboard is something you can use to monitor your performance, how you're doing on the denominator and the numerator for these criteria. So that is MU2 Dashboard. So you can see your numbers, and once you click on a particular criteria, you can see all the patients you have satisfied for, all the patients not satisfied for. If you see something, you can take corresponding action and go there and view the changes, etc. So that's how you monitor. And if there is anything in the danger, if there is anything in the red, which means it is not meeting the required percentage, you go into and focus on getting those things done. That's how you can monitor the meaningful use to. We are going to bring the 10 measures here so that you can monitor it without any problem. Lastly, but not the least, I just want to give a slight introduction on clinical quality measures. As far as the clinical quality measures is concerned, along with the 10 measures, as far as meaningful use stage 2 is concerned, you will have to submit certain clinical quality measures data. So how do you do, what are the clinical quality measures data that you submit? What is the criteria for it? One of the things is, like the meaningful use, there is going to be a denominator and a numerator for the clinical quality measures. But one of the things you do not have to do is, you do not have a required percentage in the clinical quality measures. You just have to report, okay, there were 30 patients with this condition in our practice, out of which we reported 2 or 3. Now for reporting, there are certain CPTs, that might need to be entered while billing, or CPT or HCPCS or J codes or G codes that you need to enter while billing those claims. Or you might have to send the data of those specific patient to a specific registry. These sort of things might be there for CQM, but there's no particular percentage. At least you need to calculate the denominator, which automatically gets calculated because you would be entering diagnosis and CPT in our system itself. So it will get calculated. But just want to give an introduction on the CQM. There is no required percentage on the CQM. You have to do 9 clinical quality measures, and out of the 9 CQMs, there are 6 domains in which the various CQMs that meaningful use stage 2 allows you to do. There are 6 domains from which you can choose. So the 9 CQMs that you choose has to be from at least 3 different domains. So just to give you an overview, I'm going to show you the document that CMS has given. So let me just switch over to that document so that I can show you. So as far as this document, these are the various 6 domains, and here are the various clinical quality measures, out of which you can choose 9. There are a lot of them. You can choose 9 that are pertinent to you, but out of that 9, you have to make sure that it is in one of these domains. Now, how to find whether it is in one of these domains is, you will have CMS based document. I can show you that document. So if you choose whatever you want, suppose you choose NQF002, you have another document which is provided by CMS which will enable you to find out what domain it belongs to. So I'm going to share it. So from this document, you can easily, so if you want to find 0002, you can just so want to find 0002, you can just choose this. You have the same thing here, and it is in domain efficiency and cost reduction. So you can compare from the old document, you can come to this document and find out what. So efficiency and cost reduction. So 0002, which is appropriate of children with pharyngitis. If I'm going here, just going to change the document to the first one I took. These 2 documents are very much available with CMS, where they can help you find what domain it is, what document to look into, etc. So I'm just going into, so appropriate testing for children with pharyngitis. It is in I think one of these effective use of healthcare resources. So basically you can find the domain and choose 9, having at least 3 different domains. That is the criteria that you need to meet. So there's a PDF document and an Excel document which you can call the CMS, or You can find it, or I can send it to you if you request me for the same. I can send it to any of your email IDs. Just let me know. I can send you these documents, this PDF and Excel. And then what I want to measure is in the BlueEHS system, we have already, since there are so many CQMs, we have already built in 9, which is already belonging to three or more different domains. So if I make myself the presenter, as far as the BlueEHS is concerned, we have already created, if you go, we have a similar dashboard for CQMs as well. So we have already created around 9 CQMs in our system. So if you can choose these 9, it will be fantastic. It is already covering 3 domains. We have already built it. And this is a dashboard for the same, where you can see the applicable patients with the numerator, denominator, and the percentage. For this, there is no cutoff percentage, so you don't have to worry. There's just the denominator and the numerator. You have to enter these numbers while you are reporting for meaningful use stage 2. That's all you need to do. If you're choosing these 9, well and good. So, but if you want to replace, say, this one, you replace this one with another CQM from that list that I showed you earlier in the same domain as the one you are removing. So many of the doctors or providers use these 9, but if they want something that is beyond this 9, they say, I don't do diabetic eye exam. They remove this and they add something from the same domain as the diabetic eye exam. So we upon their request, we customize and put in that particular measure along with this. We add it along with this so that they can monitor how they are doing on that one. Now, as far as the CQMs is concerned, how to meet the numerator and the denominator for those CQMs, that has to be there are around 200 plus CQMs. So on a case-by-case basis, we have to deal it, because we can't deal with all of them in a training session. We have to do it on a case-by-case basis. But there are documents available from which you can very well do this. So this is the dashboard for CQM report. So there's meaningful use stage 2 report and the CQM report that you can look at for monitoring CQMs. So finally, I had mentioned about a relationship between CQM and the CDS engine, which is the second rule on the meaningful use stage 2. What they have mentioned in the second rule is that out of the 5 CDS rules that you create, 4 has to be linked to the CQMs you are doing. So if you are doing these CQMs, based on these CQMs, you have to customize the CDR engine such that it is related to the CQMs that you're doing. If you're doing for diabetes eye exam, foot exam, and prostate cancer, you have to make sure that at least 4 of them, that are the rules that are there in the CDS engine, has to be related to the CQMs you are doing. So that again, if you are doing these 9 which we have mentioned, you have no problem, because we have these 9 in the report that is there for the CQM. You will have no problem, because we have already created those in the CDS engine. These 9 that you have in this area, we have already created a dashboard for it, so no need to worry about. We have already created the CDS or the decision rules for it in the CDS engine that we have. But if you want remove some of this, maybe if you have at least 4 out of the 9 that is listed here, you will be taken care of. You don't have to change anything. If you choose only say 2 or 3 of these, or 1 or none of this, then you'll have to revamp the CDS engine to make sure that it meets the criteria. So if you choose at least 4 out of these 9, you are fine with it as far as meaningful use stage 2 second measure first part is concerned. I hope this gives a clear picture in some way regarding the meaningful use stage 2, how to meet the criteria, what is the area, where is the dashboards you can look at, and the CQMs that we do, and how you can select the CQMs, the percentage cutoffs on the CQMs, and those sort of things. Obviously, there are three documents that I had used today. One was the stage 2 help document that I was showing you in the first part. Then there is the CQM PDF that I was showing you. Then there was also a CQM Excel, which would help you to find the domain as well. These three documents I can obviously share with you at any point of time. You can send an email to samtk@zhservices.com for this. Sam, SAM, T for Tom, K for Kite, @Z for Zebra, H for Health, zhservices.com. So please email me. Please feel free to uh, type in anything that you have a query about. I can assist you, or I can send some resources along your way to assist you on the same. Hope you had a good time listening to this and understanding what is the meaningful use stage 2 and the clinical quality measures. Have a nice day. Please do get in touch with me if you have any queries. Thank you very much.